Doing a return demonstration for an intramuscular Z tracking technique for our patient today. And I'm going to review my MAR and my physician orders. So there's physician orders and there's the MAR. And we're going to be giving Rosefin 1 gram intramuscularly every 12 hours. And we set up so this patient would get it at 8 and 8. Or 8 in the morning and then 8 at night, which would be 2000. So we're going to grab our medications. Alright, so we've got our Rosefin powder. It's going to be reconstituted. We're going to check our vial. We're going to look for our expiration date and our lot number. And then we're going to also read it to see what our diluent is going to be. This Practivial says Practivial solution. We looked up Rosefin, and you can use normal saline, sterile water, and lidocaine. So we're going to use normal saline. We're also going to check our normal saline for the expiration date, make sure everything looks intact, that it's okay and clear, good to use. On our reconstitution vial, we're going to look at the back and calculator strengths on the back here. We've got 300 milligrams per mil, 400 milligrams per mil, and 500 milligrams per mil. Just to be nice to the patient and use the smallest amount of volume that we're going to be injecting, we're going to use the 500 milligrams per mil. This says that we need 5.6 mils of diluent, and that's going to equal 6 mils total in the vial once it's reconstituted. So we're going to need 5.6 mils of normal saline, and then 500 milligrams per mil. To get 1 gram of medication, we're going to need 2 mils. So we're going to put 5.6 mils of normal saline in here and draw out 2 mils of fluid to give 1 gram of Rosefin to our patient. So, alright. So we're going to do hand hygiene, and we're going to pop our tops of our medications, and we are going to clean the tops of them. Alright, and then we're going to use a 6 mil syringe, and then we got a bigger needle. We're going to draw air out of our vial so it doesn't become overpressurized. That's what we did in class. So 5.6 to 6 with air. We're going to put it in our normal saline solution. I'm going to tip it. It's going to start filling because it's pressurized. Lots of bubbles, so let's go with this. Six. Now we're going to make sure, go 5.6, we're going to put it in our reconstituted medication. Okay. We kept that safely, and then we're going to mix this. You don't want to shake it. You don't want to destroy the medication. Okay, so it's slowly mixing, but for the constitutes of time, we're not going to sit here and shake it for forever, but you would continue to mix this until there's no granulation at the bottom. It's almost there. so then we're gonna use a new syringe with the proper size for drawing up our medication. But we do not want to use the needle that's in this one because we don't want to we don't want to dull the needle when we inject the patient. So we're going to use this one. We're going to use our previous needle from our diluting syringe. We're going to clean the top. Remember, it's 500 milligrams per ml, so we're going to drop 2 mils of medication. So 2 mils of air. It's longer needle, so we have to be careful how far in there we're putting it. So 2 mils of air, water solution, 2 mils of Rosefin. Okay, and then we would label this. We're going to switch our needle. So one we're going to use on the patient, so we'll label our Rosefin, 2 mils, 500 milligrams per mil, and then we're going to also label our solution that we reconstituted. We've got a label here that we've made up, patient's name, room number, Rosefin, the strength, and then the diluent that we added. So I probably wouldn't use this big of a one. I think this is really meant for IVs. Usually they're smaller ones because we wouldn't want to cover up the label at all. So we're just going to stick it down there. All right, we're going to go find our patient. Alright, hi Mr. Rocker, my name's Megan, I'm your nurse today. Dr. Jumpy ordered a Rosefin injection, which is just an antibiotic. It's a pretty big one and it's kind of sore, so we have to do this in a bigger muscle. We're going to do your vastus lateralis. Let's see, can I have you verify your name and date of birth for me?
Skip Rocker, 1/1 of 1972.
Perfect, Skip, alright. Alright, so I'm going to pick on your leg. Is that okay?
That's fine.
Alright. So I'm going to wash my hands. Gloves. Stupid gloves. Okay. Alright, I just want to look at your leg. Here's Skip. Alright, so Skip is not a real patient. Normally we'd have a bigger muscle and movable skin. So we're going to use the Z-tracking technique, which we would find our landmarks. So we'd use a greater trochanter and then the bottom of the knee. We'd kind of isolate our muscle that we're going to use. We go to the middle. You would put your hand above where you're going to do your injection and pull up. That way when you inject your medication and you release, that would close your opening for your medication so it couldn't escape. But we're going to have to pretend on Skip because he's a little tiny. Alright, so we'd find his greater trochanter, we'd find our muscle, we're going to go right in the middle here. So we put our arm up and pull up on his thing, on his skin, on his leg, and then we clean, clean, clean. And we're going to stick it in there. Don't sideways, Skip. Alright. And we'd slowly give the medication, or actually, we're going to hold and aspirate, breathing air. We give this medication because we're good. We'll give it kind of slower. We don't want it to burn or hurt. Alright, pull out. Use our safety. We relax the muscle. It should seal off, so we shouldn't need a band-aid or anything like that. We make sure, Skip, you're doing okay?
Yep, I'm fine.
Alright, here's your call light. We're going to come back and check on you. We would dispose of this in a sharps container. We don't have one. I'm going to take all my goods off, hand hygiene, and we're going to document. So we gave this in his right vastus lateralis. At 8:30, and my initials on the bar. Alright.